Hi everyone, Dr. Nemechek here, and I want to give you my thoughts about the use of Leucovorin in autism. It's been a very kind of popular trend here lately. And so first, Leucovorin is a metabolized form of a vitamin. So our brains need vitamin B12. People have heard that a lot. Our brains also need another B vitamin called folate. And for folate to get into the brain, your neurons have these little receptors. Folate will hit the receptor and get sucked into the brain. Okay? And the concept here is that people are claiming there is an autoimmune disorder where antibodies go in that receptor and now folate can't get in. And they have deficiency of folate in their brain. Leucovorin is a metabolized form of folate that doesn't need the receptor, and so it can get sucked into the brain without that, and it can bypass this problem. Very trendy, all sorts of miraculous stories on the internet, and I do not promote this at all, and I'll tell you why. One, Leucovorin is pretty toxic. Okay, I'm going to go into that in a minute. There's very little research on using this in kids. Most of the studies are from the same people redoing their same studies. So, although fine, you want other researchers to be able to confirm that, what they're seeing, and so that's just a basic fundamental research problem. The test they're using, called the FRAT test, is not an approved test by the FDA. There isn't a body of people saying you do it this way, X, Y, Z, and that's the best way to get it. Like if you have your thyroid stimulating hormone or your TSH done, everybody in the country does it one way, the best way. Why? Groups of scientists have told us how to do it. So this was just developed by a guy in New York, and a bunch of labs are just doing kind of their version of it. And so it's, for most science, most medicine, it's not a good test to use at all. Now, one of the just kind of fundamental problems I have is, so you take these autistic kids who have what they call FRAT, so this test, and they say, oh, this is contributing to a whole bunch of their symptoms. Well, if you look at their siblings, about 50% of, so your autistic child, you have a neurotypical sibling, 50% of them also have FRAT positive tests showing this blocker, meaning they can't get cerebral folate into their brains, but they have no symptoms. A third of the parents have the same abnormal test result saying they can't get folate into their brain, but they have no symptoms. So I'm like, how can this test be meaningful in some kids and not other kids? That's just that's a huge problem in my mind. Now, how could you really, if this FRAT test is inaccurate, maybe we got problems there, what do you have to do to really determine that? You have to do a spinal tap on your child. That's how you can tell if they have cerebral folate deficiency. Okay? You're not going to be doing that. No way are we going to be doing that. Especially when we aren't even certain this is real. Okay? Now, another huge problem I have. The dose they're recommending children is 50 milligrams per day. That's the dose they want you to get up to. I've used Leucovorin for 40 years in patients. I have some patients, we use an anti-inflammatory drug called methotrexate. Methotrexate will block that receptor. It's well known. And to prevent any problems in adults, they get 5 milligrams once a week. These kids get 10 times that amount in a single day. We're using massive doses in children, of which we have no idea what this might do. All right? And then finally, what's the risk of this drug? So, again, call me old-fashioned. In the old days, you had to give the first dose in the hospital because sometimes it would trigger anaphylaxis. Yeah. Angioedema, they may quit breathing, So we give the first dose in the hospital. Now, later on, what I would do is They gave the first dose with somebody else in the household. That person knew what to watch out for, and if they saw any reaction, they were to call 911 immediately. That's how I would handle that. But still, here, that's not happening. That's the real world of leucovorin. Okay? Now, what kind of things? Wheezing, shortness of breath, irritability, just you can trigger negative behaviors. You have gastrointestinal problems, nausea, vomiting, diarrhea. The immune system can be activated, and you start seeing these like rashes. Stomatitis is like redness and ulcers in the mouth. Alopecia is hair loss, hives. I had a case where it looked like it triggered eosinophilic esophagitis in one child, and can cause flushing, and then your blood pressure system flushing, elevated blood pressure, low blood pressure. And these are symptoms, and typically in children, they can't tell you that they're feeling something. So by the time you recognize it, it's already gone on and gotten really bad. There's just no way this drug is ready for prime time. Too risky. They don't know what they're doing. And the guys who are really promoting this charge a huge amount of money to people, for their advice. It's just grotesque what they do. So that's my take on it. And I should make one other comment. We've had a lot of people here go ahead and start it, and they'll be like, "Oh, it's great, it's great." And then after this is almost every single one. After 6-8 months, I'm typically going back over the med list. Oh, what about that Leucovorin? Even though they were all hot as potatoes on it, and were probably on Facebook chatting up how great it was, they ultimately said, "Oh, we didn't think it was doing anything, so we stopped." Vast majority of them. So don't get taken in by all this stuff online. Parents, bless your hearts. You're just so desperate to see your child improve, and you'll start something, you see some little gain, and you just get so excited, and you want to share that. And I understand all that. You got to ignore that. This drug is, I don't think, going to help your child, and this drug could seriously harm your child. So I hope that's helpful for everybody. Otherwise, everybody, take care. Have a good week. Bye.